Hello guys, and welcome to the Uncomfortable Topics video series. The video series that touches on all the uncomfortable topics that you don't want to talk about in person. So for today's edition, we're going to be talking about urinary tract infections. It's such a prevalent issue that I have in my clinic. So I really wanted to have a bit of a deep dive into what the causes are, what are the risk factors, how we can treat it naturally at home, but also further things that we can do to investigate the cause and get rid of the primary cause of the infections. So first off, we'll start off with what a urinary tract infection is. So it's an infection that is through the urethra, which is basically the hole that we pee through, but it can extend further into the bladder, and also if it goes too far, then it can go into the kidneys as well. So some of the symptoms are needing to frequently go to the toilet all the time, even though there may not be much urine, there's that urgency to go constantly. You may be going very frequently with tiny little bits of wee coming out. It may be cloudy. It may have a very strong smell. It can have a bit of pelvic pain, particularly in women. It'll cause pelvic pain. Different colored urine, so it might be a little bit pinky. It might be red, or it might be a really dark color, like almost like a cola color, and that can be an indication that there's blood in the urine. So absolutely go to the doctors if it's getting to the stage where you can see the urine. Okay, so most of us would already know a lot of those sort of things, what a urinary tract infection is, but the cause is not really talked about a lot. So it is normally caused by bacterial infections. We know that in relation to the fact that it is often treated with antibiotics, but there are specific types of bacteria that are very implicated in urinary tract infections. And the biggest one is E. coli. So E. coli, we would have heard of it. You can get food poisoning with E. coli, but we all have a natural amount of E. coli in the gut, and it's actually quite protective for our gut. So it's always there. But when it becomes a urinary tract infection is when the bacteria from the gut is coming forward, and this is why it's so prevalent in women as opposed to men, because of the proximity of the anus to the urethra. So it's basically, the bacteria from the gut coming forward and being able to enter the urethra and cause an infection. So E. coli is the biggest one. Now, the second one is not actually a bacteria. So if you are getting treated with antibiotics, it may not treat the root cause. And that one is Candida, so yeast infections. So if you tend to get thrush and urinary tract infections, it could be because there's Candida underlying. Now, another one that I see quite often in my practice is Enterococcus. So this is another gut bacteria that has a huge relation to urinary tract infections. However, that one is antibiotic resistant. So if you're somebody who's gone through all the courses of antibiotics and you're still getting urinary tract infections, it could be a case of Enterococcus. Another one that is I find all the time in gut testing is called Streptococcus, another bacteria. Now, Streptococcus is could be started by an infection in the throat called strep throat, which you may have heard of, which is just a really dry, sore, very inflamed throat infection. It can show as tonsillitis. It can show as school sores, which are like weepy, red, inflamed sores around the mouth caused by a bacterial infection, or it could be other bacteria, but they're kind of the main contenders when it comes to causation of urinary tract infections. Now, another reason that treatment with antibiotics may not work is because the bacteria can hide under something called a biofilm. So basically what a biofilm is if there's any bacterial, yeast infections, parasites, all that sort of stuff, just anywhere in the body, they can create literally a protective shield around themselves made of protein, lipids, and carbohydrates. So they'll be sitting in an area, and as they get stronger, they create this shield around them. So even if you're throwing treatment at them, it's not going to get to them because they've got this protective shield. So that's another reason that the urinary tract infections can be antibiotic resistant. And also, if it's candida driven, antibiotics don't work on fungi. They need to be treating bacteria to get any effect. So if it's a candida, which is a yeast-based organism, it's not going to even touch the sides with antibiotics. So a couple of risk factors for urinary tract infections is a lot of sexual activity, because there's a lot of juices flowing and a lot of movement. It can kind of push the bacteria around, and then it can get shoved up into the urethra, literally. Poor immunity. So obviously any place that we're getting chronic infections can be an indicator that there needs to be some work done on increasing immunity. Menopause is another time of life that you're really more susceptible to urinary tract infections, and that can be because of dryness in the vagina, and obviously dehydration is a huge thing, because you're not flushing out your urinary tract as much if you're not peeing as much. So some prevention that you can do at home is, this is for the ladies, because obviously guys don't normally wipe themselves when they go to the toilet, is when you're wiping, don't go from the back to front with toilet paper. Make sure you've got your toilet paper and you're going from the front to the back, and that's going to prevent any of the anal bacteria from being spread to the front and then have the ability to go up the urethra. If you are having sex, make sure that you're getting up very quickly after sex and going and peeing and flushing out that urinary tract. Also avoiding things like vaginal douching or deodorants, because they change the pH levels in the vagina. We have a certain pH level in the vagina to fight off bacterial infections, so changing that pH level is not a good thing. And also it can irritate the urethra by using those sort of products as well. So we don't want any inflammation in the area getting worse. And drinking lots of water. So there's some really basic kind of things. If you find that you are getting a urinary tract infections, there are a couple of things that you can do at home to treat them. So the first one is to get some medicinal teas. Now there are very specific ones for urinary tract infections. The first one being buchu. That's B-U-C-H-U. So you can find the teas that I'm going to tell you, you can actually normally go to a health food store, the ones that have got the loose leaf teas, and get them to make it up in a mix for you. So first one being buchu, because it's a urinary antiseptic. The second one is uva ursi, so it's UVA-URSI. It's also called bearberry. It's so good at treating urinary tract infections, bladder infections, just amazing herb. So if it's a really bad infection, it's probably better to use it as a liquid herb, which I can prescribe, but at home you can get it as a tea. And also dandelion root, because it is a cleanser, it's a diuretic, it's going to push the wee through quicker. If you're a little bit irritated, I might get rid of the dandelion root, but if you're wanting to just keep flushing, it's a really good remedy. One that you probably all know is cranberry, so unsweetened, because we don't want to feed the bacteria with extra sugar. So make sure it's an unsweetened cranberry juice, because what that does is it doesn't allow the bacteria to adhere to the walls of the bladder, so at least we're getting that flushing. Or you can get cranberry supplements. There's a really good one from Thompson's that's readily available even from Chemist Warehouse. So cranberry unsweetened juice or cranberry supplementation. And talking about those biofilms before, there are some natural ways of breaking down biofilms. So the first one is good old celery juice. It's bloody good for everything, this celery juice. It has something in it called luteolin, which is a constituent or a chemical that can break down biofilms in the urinary tract. So celery juice, chamomile tea, really strong chamomile tea, so maybe 2 or 3 bags that are steeped for 15 minutes, green capsicum, and also thyme, the herb. All of those things contain luteolin, so they're really good at breaking down those biofilms. So make a juice with all of those things and maybe flush your system every day. But if you really want to get down to the root cause of why this is consistently happening, like with most things, I recommend gut testing. Find out what critters are causing it. Then you can have very specific herbal or antibiotic treatment if that's what you want to do. Go find the root cause. Look at the gut bug. See if there's the bacteria. See if there's the candida, and then go into treatment. I normally do complete microbiome mapping or a complete digestive stool analysis, depending on what I think my patients need. But I hope this is helpful and explains some of the ways that you can prevent it at home and some of the things that we can do going forward to prevent further infections from happening. So until next time, guys, look after yourself, stay healthy, and I'll talk to you soon.